Governor Mary Fallin says she supports the medical use of cannabidiol oil, which is derived from the marijuana plant. Researchers believe the oil could be effective in treating rare conditions in children that cause seizures and strokes. The governor says she will ask lawmakers to allow medical trials for the use of the non-intoxicating oil.
As governor, I am not for legalizing marijuana in Oklahoma, nor am I for legalizing medical marijuana in the state of Oklahoma. As we have seen in other states across our nation that have gone down the path of legalizing marijuana, it becomes quickly an avenue to spread the wide use of marijuana and potentially other drugs in society. So I am not for the two petitions that are out there right now being circulated for either medical marijuana or legalizing marijuana. I think it would be a travesty to our state if we did that. But I'm here today to stand with Representative John Echols, who has an interim study that he's been approved by the Speaker to do in our state that would look at clinical research of non-intoxicating CBD oil to be utilized for children in our state who have debilitating seizures, epilepsy, and the potential of stroke, and to be able to have a research trial that would see if the CBD oil would be able to help our children who are suffering from these types of illnesses, and to be able to help our parents. And as a mother, I'm certainly very sympathetic to mothers and children who are facing epilepsy and seizures, and if there is something out there, such as a CBD oil, under a clinical trial that might be able to help these children have a better quality of life and be able to help these parents, then I encourage Representative Echols and the other legislators who will be involved in the study to pursue that avenue and present me a report and show me their findings. So
here's the direction we're planning on taking the interim study, because as I talked to other legislators, there were other parents who were hearing similar stories from constituents. The goal of the study, my portion of the study, is going to be to look at non-intoxicating CBD oil. I want to be clear, it is simply not true to call this medical marijuana. We're talking about below 0.3 THC. Under the federal definitions, we're talking about hemp. We're also talking about non-intoxicating for a reason. That's what the federal definitions show. And then we are going to bring in pediatric neurologists from this state, from other states, to talk to the Congress, to talk to the legislature, to see what exactly it is we're dealing with. This is going to be a true, now obviously I having looked at it, believe in this issue, but it's going to be a fact-finding interim study. We're going to need to convince the members of the Public Health Committee that there's not a chance of abuse, there's not that possibility of abuse because it's non-intoxicating. We are going to have to convince them that the clinical study is going to be done well. So we are sure that we're using a study that will ensure it won't allow higher than 0.3 THC to come into the state. All of these things are going to be dealt with during the study. What we are talking about is a liquid form that is shown to be helpful, and by last count, 11 other states have looked at this same issue. I'm proud to take on what I think is a very tough political issue, and I'm proud to take it on for the citizens of the state of Oklahoma. They deserve for us to talk about it.